Today we're going to be going over the abdominal exam, and starting out you want patient supine, exposed from the xiphoid process down to the pubic area. You want to make sure that you ask your patient to empty their bladder if they have not already. And Jeff, have you emptied your bladder?
I have.
Good. Okay. You want to make sure that the patient has their arms by their side and that their head has some form of support. Starting out, we're going to be inspecting the skin, and we'll be looking for skin color, any masses, vascular abnormalities, contour, or any other abnormalities. Next, we're going to be doing auscultation, and you want to do this with the format of peristalsis, starting in the right lower quadrant, right upper, then left lower. So I'll be using my diaphragm, and you want to do this for about 5 seconds. You want to do 3 spots per quadrant. I'm going to go just a little bit faster for sake of time. Go to the next one. And normal range is about 5 to 35 bowel sounds per minute. If there's only 1 to 4 bowel sounds per minute, it is considered hypoactive. If there are more than 35 per minute, that is considered hyperactive. A complete absence of bowel sounds over the duration of 5 minutes is considered a medical emergency, and you do want to call 911 and get an ambulance there. While listening to bowel sounds, you're going to be looking for frequency and character. Next, we're going to be listening for friction rubs, and during this you have the patient take a deep breath each time that you place the stethoscope on them, and you'll do this 3 times. Just take a deep breath and release. And again, you're doing this with the diaphragm. You'll do this again with the spleen. Okay. Next, you're going to use the bell of your stethoscope, and you're going to be listening to the major arteries. The first one is aorta, and you can use the bell on here, and that's about the size of an inch. So you'll go 1 bell up and 1 bell over. Next, you'll do renals, and this will be done bilaterally. So it's 2 inches up and 2 inches over, so you can do 2 bells and do that for about 5 seconds. And again, I'm just going to go just a little bit faster for the sake of time. And then the common iliacs, which is 2 inches down, 2 inches over. And the patient can remain breathing normally during this. And finally, I'm going to be doing the epigastrum for venous hum. And can you take a breath and hold for me, please? And about 5 seconds there as well. Next, we're going to be doing percussion, and you do this with peristalsis as well, starting with the lower right quadrant. You're going to do 3 spots in all 4 quadrants. And we're also going to check for distended bladder, and that's just from ASIS to ASIS. Okay, next you'll check for liver size, and you're going to percuss down the midclavicular line, just about below the nipple, and move down until you hear a dull sound, which will be about right here. And then for the bottom portion of it, you're going to start just about the belly button, move up a little bit, and wait till you hear the dull sound again. About right here. And that's for liver size. Then you'll check for tympany of the stomach. And again, start midclavicular line just below the nipple. And that was right there. And you only have to do the top line on that. And you'll do the spleen as well, checking for dullness. And you're going to come along the mid-axillary line. Right here. Then we're going to go on to palpation. You will check for both light and deep palpation for pain, tenderness, muscle guarding, and masses. You'll perform light palpation in all 4 quadrants, again, going in the correct sequential order. and that's just very light. And you'll continue to do that in this quadrant and this quadrant as well. Next I'm going to do deeper, so can I have you raise your knees and place your feet on the table for me, please? And for deep palpation, just go a little bit deeper. If you have a slightly overweight patient, you're going to want to go anywhere from 1 inch to 2 inches deeper. And again, you're checking for pain, tenderness, muscle guarding, or masses. On the last quadrant, you're going to have your patient do a half sit-up. Can you do a half sit-up for me, please? And upon a half sit-up, okay, you can relax. Upon a half sit-up, if the mass remains present, it is a superficial mass. If the mass disappears, then it is a deep mass. Next, we're going to palpate for the liver's edge using the standard maneuver. And I'm going to place my hand just underneath your side. So can you lean up for me, please? Okay, and down. And for that one, you're going to have your patient take a deep breath and hold. I'm just going to be palpating along the edge. And can you exhale for me? Okay, perfect. I'm also checking the gallbladder at this time, looking for a Murphy sign. If you have a positive Murphy sign, it's called reflex apnea, where the patient would take in a sharp breath or stop breathing, and that would indicate cholecystitis. There are 2 other methods to palpate the liver, which you don't have to show, you just have to verbalize, which are Middleton's maneuver and Hooking maneuver. Next, we'll check for the spleen, and I'm just going to place my hand underneath your side. Okay, and relax. And I'm going to pull A to P, and I'm going to ask the patient to take a deep breath and hold. So can you take a deep breath and hold for me? And I'm just going to try and feel the spleen as it moves down when he takes a breath. Okay, you can relax. Next, I'll check around the umbilicus. I'm just palpating for tenderness, bulges, or nodules. And then I'm going to check the abdominal aorta. You will then go on and do kidney entrapment, and you place your hand underneath your patient. You have them take a deep breath and release, and as they release, you let the kidney go. You will also do that on this side as well.
And that's the one time you can walk around the table?
Yes, that's the one time you can walk around the table to the patient's other side. Then I'm going to palpate the urinary bladder, which again is just in between the AS-IS. Okay, that's good. Then you check for rebound tenderness, and this is for Rolzevings and Blumbergs. You just push and release. A positive Rolzing sign is if the patient feels pain in the lower right quadrant upon the rebound test of the lower left quadrant, and that indicates appendicitis. Positive Blumbergs is if the patient feels pain in any quadrant, and that's indicative of peritonitis. Sorry. Next, you'll test for ascites using the fluid wave method. There are 2 other ways to assess this, which is shifting dullness and puddle sign. Again, you only have to do the fluid wave. And you're going to have your patient place their hand down the middle of their body. Okay? And it says that you can sharply flick the patient. I'm just going to lift from the side and release. And you do that on both sides. If fluid motion were to travel to the other side, then it'd be a positive indicator. You can relax. Then you have to ask your patient 3 questions. Do you have any pain?
No.
Are you hungry?
Yes.
Have you eaten anything today?
No.
That might be why. Next, I'll check for psoas sign. And a positive indicator with this is pain in the left, right, or lower right quadrant, which would indicate appendicitis. And all I'm going to do is I'm going to place my hand on the iliac crest and my hand on the knee. And can you lift up against me pushing down? Okay, did you have any pain with that?
No.
Good. And then the next one is obturator sign, and if you have a positive sign, it's an indicator for pain upon action, indicating pelvic abscess or ruptured appendix. So I'm going to have you flex your leg up to a 90 degree, okay? And can you push outwards against me? Great. And then push inwards. Any pain with that?
No.
Great. And for The last one, can I have you go ahead and sit up for me, please, with your feet this way? And this is considered Murphy's punch, and patient is seated, and you go about the T10, T12 area, and you just place your hand right here and do a light punch, and then you do it on the other side as well. And if there's any pain with that, it could indicate a nephritic condition. And that's roughly everything that you need to know for the abdominal exam. Happy studying.